These folks were in their early 50s. Most of them were around 52. They had, not everybody had had the opportunity to be exposed to any subsequent discussion about what would happen post-op. So the special care group was the group that had the specialized discussion. Prior to surgery, Dr. Egbert sat with them, talked to them about the fact that they were going to have pain, talked about the kind of pain they were going to have, what they could expect, the fact that they would have medication that they could get on demand or upon request, that there were certain activities that they could engage in that would help them mitigate the pain along with the medication. He was very good about it, very invested. I mean, this is 1964. He's a pioneer as far as I'm concerned in pain management. The control group got no discussion about how pain would be mitigated, how it would be addressed. They just knew that they would be able to have medication. So in his role, Dr. Egbert basically normalized the whole concept of post-op pain, but also told patients what they could do to help deal with it. He told them that they would be able to use a trapeze over their bed. He talked about different positions they could take that would help them become more comfortable. He talked about deep breathing, muscle relaxation. I mean, this is early. This is 53 years ago. He was very reassuring. He saw the patients post-op in the recovery room. He saw this special care group the same day again in their room. He would see them once or twice a day, reassure them that they probably would do well with all the things that they, had learned. He educated them, but that they could take medication whenever they needed it. They were pretty happy about it. He was also very positive, lots of good bedside manner. The control group, as I said, got none of that. So what happened with these patients? Kind of interesting. The results of this were that the patients who belonged to the Nordstrom's group were more comfortable. They were more proactive. The first and second day post-surgery, everybody used about the same level of narcotics. Subsequent to that, the next 5 days, the amount of medication titrated off substantially for the Nordstrom's group remained fairly consistent for the control group. They got so good at mitigating pain with additional activity, not related to medication, that they actually decreased their narcotic use by 50% and were discharged 2.7 to be exact days earlier than the control group. The control group had lots of complaints about pain, and there was a lot of agitation as to why they hadn't been instructed previously about what kind of pain they would have.